And welcome to Sugar Talk with Dr. KG and Lucas here on the Talk Station, FM 107 and AM 1240. And she's in the house. And good morning, Doctor. How are you?
Good morning.
All right, what are we talking about today?
Cholesterol again.
Part 3.
Part 3.
Okay. All right. So, what do we want to focus on today?
Well, we're going to talk about medications for cholesterol, but we need a goal in mind. What cholesterol number, do you need? And it sort of depends on your risk factors for heart disease, because the idea about lowering cholesterol is to prevent heart disease. People don't feel different if their cholesterol is 400 or 200, but their arteries certainly are attacked by the high cholesterol. You get plaques in your arteries. So the goal depends on what your risk for heart disease is. And if you've already had a heart attack or a stroke, then you need a lower number than somebody that doesn't have any risk for heart disease. So they want it under the LDL, which is the bad cholesterol, the lousy cholesterol. They want it under 100. Some people say even under 70. So the lower the better as far as the LDL goes, the bad cholesterol. If you have 2 or 3 risk factors, you get a little bit more leeway. You can have it under 130. And if you have no risk factors, under 160. So there is a number which everybody probably would need to be treated if it was really high, if you especially have a genetic predisposition to high cholesterol, if that's in your family.
Okay, all right. So the first part is knowing your risk factors and getting that number down.
Yeah, we mentioned the risk factors before, but family history of early heart disease is a risk factor. Smoking, diabetes, high blood pressure are all risk factors. Obesity and sedentary lifestyle, of course, are risk factors. Central weight in the abdomen is a risk factor. So all those things are risk factors. We'll talk about triglycerides at another point, but triglycerides are a risk factor, high triglycerides.
Yeah. Well, I was going to ask you if are they related? How are they related? Because that seems to be always in the same conversation.
Yeah, triglycerides are in part 4.
Okay, all right, we'll get to that. All right,
they deserve a separate talk.
So with these numbers in mind, again, you're talking about separating the HDL and LDL numbers, though, as far as goals go? Or?
Yeah, the LDL is important. Of course, if your total cholesterol is very low, your LDL is going to be low and your HDL is going to be low. HDL is the good cholesterol. You want the good cholesterol over 40, but if everything's so low, then it's not going to be over 40. So you mainly want to do the LDL number. There's other ways of measuring things. There's lipoprotein. There's very complicated ways of measuring the small, dense lipoproteins, but that's sort of complicated. So we'll just stick with the LDL for right now.
All right, so what are the medications? I mean, are there a variety of them, or are they basically a single class?
Well, there's 3 basic classes for cholesterol. Niacin is sort of a separate class, but the 3 basic ones are prescription medicines for cholesterol would be the statins, which used to be called HMG, CoAce reductase inhibitors. So that's why they call them statins.
Okay, thank you. I appreciate somebody who did that.
And probably because statin is in the name, the last name. So atorvastatin, which is Lipitor, and simvastatin, which is Zocor, pravastatin, Pravachol, rosuvastatin, which is Crestor. So all those, a lot of them have the ORs on the end for heart, COR rather. What they do is reduce the production of cholesterol by the liver. So they partially block the first enzyme that starts off with making cholesterol. So that's how they do it, and that's a very effective way of doing it. The very first dose you take, the lowest dose, probably drops it the most as far as a percentage. Subsequent increases in doses drop it a few percentage more, but if you're going to get a really good response, the very first dose you take. And of course, the lower the dose, the less side effects. And we'll talk about side effects a little bit later. The other group is the bile acid resins, which were the first ones before the statins, and that was cholestyramine. The other ones are cholestyramine, and the newer one is Welchol. So what they do is bile contains cholesterol, and they bind the bile in the intestines and pull cholesterol out of the body that way. So they're not used as anymore considered. Well, they're used some. They really work well with diarrhea. If you have high cholesterol and diarrhea, then cholestyramine is great because constipation is the main side effect of those. and plus they're gritty and disgusting to drink. But Well-Call is in a pill, so that makes it a little bit easier.
So again, that has a specialty use more than a general use.
Yeah, it used to be used a lot.